Thank you so much, Paula, and welcome to this evening's Fireside Chat series. I already had the pleasure of speaking with a couple of you already by this unlit fireplace, and so we're really we're really trying to employ the title, you know? So my talk tonight will be on how to reduce your risk of falls. So without further ado, okay. So the overview for this evening's talk, the first thing that we're going to do is to discuss the definition of a fall and common phrases that people may use to describe when they have a fall. Next, we're going to get to kind of the meat and potatoes and discuss why falls are important. And then we're going to go through risk factors for falls, both what we call, and this terminology was, or these words were used last week, which I know maybe not all of you were there last week, but it was an excellent talk on stroke care in Muskoka. And they used the words modifiable and non-modifiable. So some risk factors that you may be able to change and others that you may not be able to change. Afterwards, we'll talk about an action plan to reduce your risk of falls. So kind of make it something that we can actually do something about. And then finally, we're going to go through some resources and community contacts to actually use some of the skills that we're going to be learning tonight and who to reach out to for help. So what is a fall? And I hate to use the actual word in the definition. I thought that was a faux pas, but it was kind of challenging. So really, it's when you slip, trip, or fall onto the ground, or perhaps a lower surface, like onto a bed or onto a piece of furniture. But the words that I often hear used, and so I'm a family doctor, and I work both in the community and in the hospital. And I get to talk with people about falls. Oftentimes it will be in the hospital when people have had a fall. And a lot of the phrases that they use to describe when they had a fall are kind of listed on the slide. So often I'll hear, I lost my balance, or I got up too quickly and maybe I felt lightheaded and then I fell. Other times people will say that their legs gave out, or they tripped on something, of course. And then other times, and this word I hear very commonly used is, I felt dizzy, or people will say kind of the room was spinning. So any one of these can be clues as to why someone may have had a fall, and it may give us a clue as to what their risk factors are and how we can try to reduce them. So this is why I chose to do this talk. Falls, and originally I had this titled as Why Are Falls Important? But I just thought I would drive home the message and title it Falls Are Important. So why falls are important is because 1 in 3 adults over the age 65 will fall each year. And to me, that is quite a significant number. And for instance, I'm working in the hospital this week looking after admitted patients, and I have at least 3 patients that have had a fall. So I'm already kind of trying to use some of these skills for how to reduce your risk of falls by kind of teaching patients in the hospital maybe things that we can do to avoid having another fall. And just kind of for a show of hands, maybe in this room, if you, or not yourself, pardon me, but if you know of a family member or friend that have had a fall in the past year, do you mind raising your hand? I know. I appreciate you raising your hands. And in my heart, I was like, hopefully not too many people will raise their hands, but I feel like there will be quite a few people that raise their hands. And so I want you to acknowledge too that falls are not a normal part of aging. It doesn't have to be accepted. It's not inevitable. It's not bound to happen. There are things that we can do to reduce your risk of falls. And falls, if or when they happen, can really significantly kind of limit people's independence and may be an event that significantly changes people's lives. So I think that's another reason why it would be kind of important to do whatever we can to reduce people's risk of falls. And again, you can reduce your risk of falls. And that's the whole goal of this talk, is to kind of give you some step-by-step actions that you can take that either you can use yourself or can kind of help family members. So we have a couple images here, and on the right is the fall cycle. So it starts where people experience a fall, and that is quite a vicious cycle because that can then kind of increase people's fear of having another fall. And that then will cause them to kind of have decreased physical activity. They may be a little fearful to participate in normal activities. And then you kind of lose the ability to do those activities if you're out of practice. And then that in turn can increase your risk of falls because people can get deconditioned. So the goal today is to kind of learn ways to break the cycle. So on the top right-hand side, you can also see a few statistics. So unfortunately, 95% of what we call hip fractures or broken hips are related to a fall or caused by a fall. And then something important to note, bottom right-hand corner, is that 50% of falls will occur in people's homes, or 50% of falls that lead to people being hospitalized will occur in people's homes. That, to me, I think it's important because it reinforces the importance of checking your home environment and making sure it's as safe as possible. And that's unfortunate that people have falls at homes, but I think it also it means that we have an element of controlling our environment. So next, we're going to talk about risk factors for falls. And these are specifically, unfortunately, the non-modifiable risk factors, which means that they can't necessarily be changed, but you may notice a few topics up on the slide that we have a little bit of control over. So the first risk factor that we may not necessarily be able to change that increases risks of falls is cognitive impairment, otherwise sometimes called dementia. This can increase people's risk of falls because with that impairment, you may have issues with your memory or with the ability to follow instructions that may increase the risk of falls. Other things that we cannot necessarily change, increasing age. Unfortunately, females are at higher risk. Frailty. So what frailty is kind of a state where people are deconditioned or may have decreased health or ability to cope with stressors or illnesses. And then heart disease. So we can't change necessarily if you have heart disease already, but last week when we talked about stroke, and again, I'm mindful that not everyone was at that talk, we can't change if you already have kind of heart disease, but there are some medications that we can do to control the symptoms or reduce your risk. We can't change whether you've had a fall in the past. And high blood pressure. So part of high blood pressure you can't necessarily control, but then we have a number of medications that you can take to control your high blood pressure and reduce that risk. A specific condition that we cannot necessarily reverse, but we can treat, is Parkinson's. And that condition causes changes that can increase people's risk of falls. Another condition, the bottom left, is called neuropathy. That's where you have a disease that affects your nerves that may control your feeling in your extremities, your arms and your legs, or may kind of you may have decreased strength, which can, as you can imagine, kind of make people a little more at risk of falling. And lastly, stroke. So last week, the whole kind of topic was stroke care in Muskoka. And one of the messages that I got last week, and I see it kind of on a regular basis, is that after you've had a stroke, you can still participate in rehab to regain some of that function. But as you can imagine, you may not be able to fully regain all the function. And so you may have a stroke that kind of limits your ability to, let's say, use your arms or legs, or you may have balance issues from the stroke, or like vision problems that we cannot fully get rid of. And these are the risk factors for falls that are modifiable. And I kind of like that there's more modifiable ones. That makes it a little bit kind of hopeful. And we'll go through these. So as you can imagine, alcohol will significantly increase the risk of falls. Other substances can do so too, cannabis, and we'll get into kind of other medications. But yeah, if you have alcohol, that can impair your reaction time. It can put you kind of at risk of kind of having a significant event. Other risk factors, balance issues. We're going to talk about different exercise programs and strengthening programs that are available in the District of Muskoka. I'm using that term now, thanks to the lovely ladies. And then other risk factors that we can change can be kind of the environmental factors and home safety, which I'm kind of lumping in together. And we're going to go through how to, or what to keep an eye out for in your home to kind of ensure it is as safe as possible. And we can also, fear of falling is also a risk factor that we can change by building confidence and maybe making some steps to reduce your risk of falls, so that we can address that fear of falling. Because of note too, we actually have one of our colleagues will be doing a talk to the healthcare providers in the next month or so to kind of go through the risk factors for falls and what we as healthcare providers can talk to our patients about to kind of do our part. So, and fear of falling is one of the main 3 questions that I would encourage the other healthcare providers to ask, because the fear of falling in and of itself can significantly let us know about which groups of people are at risk. Other conditions, and we're kind of in the middle on the far left there, chronic pain. Pain itself can decrease your ability to move, but also the medications that people will take for chronic pain can have side effects that increase risk of falls. Other conditions such as depression, likewise, that can have medications that you take that can increase your risk of falls. Delirium in the center there, that is a condition, and often it can happen at home or in hospital. So that is a condition where people can get all of a sudden confused and their attention may be limited. And often that's from other medical conditions, or a cause. But that state where people are not necessarily able to follow direction or maintain attention can be a state where people can certainly have a fall. Other risk factors, lack of physical activity and that kind of muscle loss that can happen from that, or that deconditioning. Living alone can increase your risk of falls. And also, if you imagine people have a fall and there's no one in the house to maybe help them up or get them off the floor kind of in a timely manner, that can lead to problems if people have a fall and then spend quite a bit of time on the ground, which unfortunately we see. Risk factors include poor nutrition, and then certain medications. And I'm going to have a slide near the end that highlights a few medications that I think can be, that we as a society and we as a medical community should look to be very careful about who we prescribe these medications to, because they can really increase the risk of falls. Smoking can increase the risk of falls. That's something that we can control. And then also, or try our best. and then vision and hearing problems. And then polypharmacy, that's where people are on kind of more than 5 medications. And medications can interact and have side effects that can increase the risk of falls. And then the last 2, age-related muscle loss and orthostatic hypotension. So what that is when people's blood pressure drops when they change positions. And so how that happens is your blood pressure only needs to be so high when you're sitting or when you're lying down in order to pump blood from your heart to the brain and to the tips of your toes, let's say. When you stand up, your blood pressure has to kind of quickly change or increase in order to kind of account for gravity and have to then pump blood all the way up to the brain. And so if there's a little bit of a lag there, that can cause people to have that, oof, I felt lightheaded when I stood up feeling. And maybe it progresses to I passed out, or that when I couldn't support myself. So, what can we actually do to reduce your risk of falls? So, the way that I have tried to outline the steps that you can take is by doing it over a timeline of a matter of days, weeks, multiple weeks potentially, and months. So to start, we're going to go through some steps that you can take over a matter of days. And I tried to have one letter that would kind of all of my steps would fit into. So we're calling the days the E's. I had to get a little creative. Although it actually did work out quite well. So the days are the E's. The first one being environment. So that is what I was talking about, where you're going to kind of do a survey of your home environment for hazards. And there is a handout at the back of the room, and I'm sure we could probably make this available for those who may be watching later. There's a handout which is like a falls prevention one-sheeter. I don't think I can say that, sorry. Sorry. There is a single sheet of paper that encompasses the reducing the risk of falls. And there is a checklist for kind of how to walk through your house and go through different rooms in the home, like the bedroom, the bathroom, the kitchen, and what to pay attention to. To kind of summarize that, things that you're going to want to kind of survey in your environment or in your home or where you spend a lot of time is things like lighting. So is there enough lighting in these areas, or could that potentially have like a motion sensor light when you're going from your bed to the bathroom in the middle of the night? Or if there's kind of dark areas that you may have kind of tripping hazards, that might be something as simple as changing the light bulb. Other areas to look at would be stairs. Are they uneven? Do they have any surfaces on them that need to maybe be fixed? And then are there other areas of the home where there's uneven surfaces? Everyone loves a little throw carpet, and that unfortunately is a big risk of falls, because really anywhere where there's a change in flooring, like there's carpet going into hardwood, or let's say there's a little step down, those are kind of, if you're rushing, those may be areas that you can trip. So you may not be able to kind of change the whole layout of your home, but if there's carpeting that's small that you may be able to kind of tape down or take away, I consider that something that could potentially be done in a few days. Other things in the house, railings. So are your railings where your stairs are they kind of properly fixed to the wall, or are they loose? Do you maybe need a bath rail or like a shower rail? Or you can even get raised toilet seats or chairs around the toilet. And then looking at your environment for any hazards or obstacles that may not need to be there that could be moved. And then something else to consider is the location of your phones in your home. So do you potentially have like a cell phone or a landline that are beside your bed so that if it were to ring, you could kind of answer it without having to rush to get up, or a phone beside kind of the chair that you love to sit in the most? And then seating. Do you have potential seating between your bed and your washroom that if, let's say, in the middle of the night you felt a little bit lightheaded, that you could kind of sit down before you fall down? And a second E is our equipment. And that's where we're getting into kind of like devices that can help you for walking, or what we call kind of mobility, or even daily activities. So do you potentially have like a cane or a walker? And then most importantly, I put up there the proper size and kind of like the right tool, because I do hear often, oh, I have a walker, it was my spouse's, and we don't know whether that's the right size. So at the end, I've got a community resource where you can, let's say, bring it into IDA or one of the other businesses in town that could see if it's actually properly measured for you. And then wearing good footwear, supportive footwear with a good solid sole, as opposed to necessarily old ratty slippers, which can increase your risk of tripping. And then a last piece of equipment that you can consider is like a falls alert system. So there are certain devices that people can wear, like let's say in a necklace form or on a bracelet, that you buy from companies that if you were to have a fall, some of them can like automatically detect if you've had a fall, and then they will call the landline or call your phone to check in on you. And if, God forbid, you're not able to answer, they can either connect you to emergency services to come check on you. And lastly, for the E's is eyes and other senses. So have you been to the eye doctor recently and had your eyes checked or had any eye issues kind of addressed? And if you're wearing glasses, are they the proper prescription? And are you actually wearing them is the great question too. Do you wear those hearing aids? Not always, I guess. And if you have hearing impairment, and again, we're all people, right? Like, I'm mindful that we're human, and so these are just kind of things to strive towards. So things that you can change over a matter of weeks. Now, I thought I'd be controversial and put up here doctor's appointment for a matter of weeks. And there may be people who will agree with me that say, hey, I can get into my doctor in a matter of weeks, with an S, Or that may not be the case, or I am mindful of the fact that some people may not have a primary care provider, a nurse practitioner, or a family doctor. We do have an annex clinic in town that accepts unattached patients. So you could look to book an appointment with your primary care provider to discuss your personal or your individualized risk factors for falls and kind of a falls prevention plan. So at that visit, you could go over your own medical conditions and which ones may increase your risk of falls, and your risk factors, and then your medications and how they may be potentially kind of increasing the risk of falls or interacting. And I do think it's actually reasonable to use our excellent allied health, such as pharmacists, that you could go in and see the pharmacist and say, hey, I had this talk on falls. Is it possible to take a look at my medications and see if there's any medications that might increase my risk of falls, or any meds that you would have any suggestions about? And we're open to communicating with the pharmacists because they're the experts in that field. And then also, speaking of experts in the field, we could consider referrals to either physiotherapists or occupational therapists to try to come up with appropriate rehabilitation or exercises, or see which tools may benefit you. Another D is our diet. So nutrition plays a very important role kind of in health overall, reducing falls, and then maintaining bone and muscle health. So another area of expertise is also nutrition, and we could also facilitate kind of a referral to a dietitian if people had questions, or there may be underlying medical conditions that people have that kind of impact their ability to eat healthy, or kind of impact their digestive system. So it's worth talking about that. And then drugs is our last suggestion for a step that you can take over a matter of weeks. Again, doing the prescription drug review with your pharmacist or your family doctor or family, friends, just to kind of start out that way. And then trying to limit the intake of alcohol or recreational drugs to try to reduce the risk of falls. So this is where I wanted to highlight certain medications that are known to increase the risk of falls. So the first category is kind of called hypnotics and sedatives. And a major class of medications that can increase your risk of falls that we are trying to limit and are actually encouraged to limit prescribing in kind of people above 60 are called benzodiazepines. They're the PAMs. They end in PAM. Clonazepam, alprazolam, temazepam. I should apologize for this. I told a patient the other day, I want you the hell off that alprazolam. So because it can increase, she was there for a fall. Pardon my language. I already said cheater, so. Okay. So, and then sleeping medications such as medications like zopiclone. And what I would propose is that we actually know there are better tools for helping with insomnia and sleep problems. CBT, or cognitive behavioral therapy, is a type of therapy that is actually first line for insomnia. It's quite effective, and it is even better in the long term. So it's not just like we're saying, take these things away and suffer. It's saying that's where it's talk to your healthcare provider about alternatives. And kind of how these medications can increase your risk of fall as you see risk of drowsiness and confusion, which they're a recipe that can really kind of cause trouble. And the second kind of class of medications that I just wanted to highlight is the class of opioids. And so these are often used for pain relief. Can be used for other things like shortness of breath symptoms, but they can increase your risk of kind of sedation and drowsiness and dizziness, and they can lower your blood pressure where you might get that feeling where you feel lightheaded, or cause vision changes or confusion. And that would be where I would propose potentially talking to your healthcare provider about alternatives. And again, you can talk to the pharmacist about that too. Bottom right-hand corner is examples of those drugs. So that's kind of like your morphine, codeine, I'll skip the heroin, oxycodone, tramadol, hydrocodone, hydromorphone, fentanyl, and methadone. Okay, and steps that you can take over a matter of months. So that's why we talked about the medications that I would kind of encourage alternatives for. So the first W and steps that you can take over a matter of months is to wean medications or substances. And I acknowledge that sometimes people will have been on these medications for years, and you cannot necessarily stop these medications cold turkey. So that's where we would try to kind of either take you off kind of slowly by tapering or decreasing the dose over a matter of time, or try to kind of lower the dose, because as you can see, the goal is always the lowest effective dose of medication. So it helps you, but it's at the lowest dose to kind of try to reduce your risk of getting any of the side effects. And I've saved the best for last. The last W is workout. So one of the best things that you can do to reduce your risk of falls, and we're going to talk about how you go about this, is to participate in falls and exercise prevention programs. So exercise actually has the best evidence for reducing your risk of falls out of anything I will tell you tonight. And it can also reduce the risk of any injuries that you can get from falls. So exercise can actually reduce your risk of falls by about 23%. Now, how do you actually do this? And some of you may already be doing this. I've had a chance to speak with some of you that are really well connected with the services in Muskoka, so this may be already known to some people. These are the handouts, and I will come back to these. Let me just finish the topic of community resources first, because that's going to talk about exercise. So the first paragraph is a specific to the District of Muskoka exercise program or programs. The first one is actually through what's called the Victorian Order of Nurses, or we call it VON, and it's called the SMART program. So that is Seniors Maintaining Active Roles Together. And I actually called the number that's up on the screen because I didn't want to put numbers up here that led to dead ends that I think would have been frustrating for you guys. So I called the number and I spoke with Kelly. She's amazing. It's a program for adults 55 years of age or 55 years of age and up, or those of adults living with disabilities. It's a free program. You can start at any time. So it's not like you have to start on week 1 or if you kind of come in at week 3, you can't participate. Again, it's free. You can self-refer to it. So you can call this number and sign up yourself. It's led by specialized fitness instructors. There are options for going in the community, and Huntsville has multiple sessions per week at Trinity United Church. And then there's also sessions in Bracebridge. And I'm mindful that there are other areas in the District of Muskoka, but these are kind of two main hubs. And then, so I spoke with them. They said, we have lots of people that come out. It's a full class, but we're always looking for new people. And let's say you could not attend in person. They have options for virtual classes. And they also have handouts that you can use if you're at home and you want to do these exercises on your own. We would encourage that you maybe start off with the group where you're learning these exercises and then you kind of continue them at home. And what we're aiming for exercise is roughly 150 minutes of exercise per week. Okay, of kind of cardiovascular activity and strength training is the types of exercise that have the best evidence for reducing your risk of falls. And then other types of exercise that really have great evidence are things like group Tai Chi. And then, so next is the NSM, which North Simcoe Muskoka Specialized Geriatric Services. That number you can call and sign up for their services as well. I wasn't fully able to get a hold of them, but if you want they still offer kind of senior services and exercise programs. And then the mobility aids and home equipment. So these are two areas in Huntsville. I had a chance to call them. And so home comfort care services in Huntsville, that would be where you could go for walkers, canes, assistive devices, falls alert, bathroom chair, or like rails in your house, or like shower chairs, equipment like that. And then IDA Huntsville also sells these products or can connect you with these products. And then for individuals that may be at risk of falls because they have a condition that limits their ability to really get out of the house, and perhaps that's a temporary condition as well, let's say after a medical event or an injury. OHIP does cover physiotherapy and occupational therapy for people that are homebound. And that can also be a self-referral, or your healthcare provider can do that referral for you. And no area code, and you can call that number and it kind of directly connects you to the North Simcoe Muskoka Ontario Health at Home. And I just wanted to do a shout out to this picture in the bottom right-hand corner. My grandpa is currently in the hospital in Sudbury, admitted for a fall. And he has this picture specifically printed in his retirement home room. He said he really liked it because he loved the smile on this gentleman's face. So I just love that he cut it out and taped it to his fridge. So he's looking for motivation. Okay. And then I'm going to go backwards for a second. And this is, and it's hard to see here, as you can imagine, but if you would like a paper copy, there's some at the back of the room with Paula. And so this is kind of a nice summary on the left-hand side of kind of some of the topics that we talked about. And in the bottom right-hand corner, there's examples of exercises that you can do, home safety checklists, etc. And then on the right-hand side, kind of the goal is supposed to be empowerment and taking steps to kind of reduce the risk of falls and feeling like you can actually make change. So they've got the handout at the back for kind of steps that maybe you can recognize in yourself that your own risk factors that might make you fall and kind of what you can do about it or who you can ask for help. And so I don't actually know what time it is. I should probably, oopsies. Do you know? Is it 7:40? That was my goal. Okay. Wow. Okay, so I wanted to leave a good amount of time for questions. Have I done it yet? There you go. Thanks. So I wanted to leave a good amount of time for questions to see if anyone had anything they wanted to ask. Go for it.
I just found that I've been using the Cogeco TV for exercises. They have excellent they have VOA exercises. They have Senior Fit with Maryland, which is all chair exercises. Every day.
That is an excellent resource. So, yeah, so what this lovely woman has said is that actually Cogeco TV airs exercise programs like chair exercises, exercises with Marilyn, right? And so they actually have the VON exercises as well. So that's an excellent resource. So shout out to Cogeco. How do I actually on television get that up here? Like maybe. So it's a channel on television. You go to Cogeco 100.
Cogeco 100, your TV.
Okay.
And just go over every morning. You can just kind of, from 9 o'clock on to 11, they have all different exercise programs.
Cogeco Channel 100, and in the morning they have a variety of exercise programs. That's really helpful. Thank you.
I'm sure YouTube has a lot too.
Yes, there are certainly YouTube videos too, which kind of the world is at our fingertips with the internet, which is quite wonderful. So I think that is a really good option.
I think you left a biggie out of the risk factor. Pets.
Yeah.
You know what? Okay, you're so right. And I'm going to put that under non-modifiable because because pets, you're right. Okay, so there was a slide that I left off here. So the comment was, you left off a big risk factor, pets. You're right. I have a patient who is in hospital right now whose dogs tripped her and she went down the stairs. And she's like, it didn't feel very accidental. And I was like, I choose not to believe that. And I was going to kind of go through an example of how multiple risk factors can add up to increase your risk of falls. And the first thing that came to mind was, it's the middle of the night, you have to pee, you're heading to the bathroom, you didn't use your walker or cane, and you had a cat. The cat always seems to get in the way, you know? I love cats, love dogs. But yes, pets, you're going for a walk with your dog, you're getting out, you're getting exercise. So perhaps, Chuck, I can,
I saw a lady at Maple Fest on the weekend, Labrador. It was not a service dog. It was a very bad one if it was. And this dog spun this lady around and she fell flat on her face on the curb.
Oh.
I was driving and there was guys in front of me, but there was a whole bunch of people around. And I think I saw her later in the day, but she would have been messed up.
Well, the dog jumped at another one. She had the dog on the leash, and there was somebody coming along with another dog, and I don't know, that dog wanted to do something with that one. Anyway, just all of a sudden pulled her right over.
We had a witness fall at Maple Fest this weekend, and if you're listening or you're out there, we really hope you're okay. Yeah.
Well, my compliments, superb. Just about everything.
Thank you. That actually sincerely means so much coming from you. I really appreciate it.
I was going to say one other thing about individuals. elderly women, large purses, a problem because it prevents them grabbing something with at least one arm's preoccupied with the purse.
Because they have crown jewels in them.
Yeah, well, they can help you fall.
That's because they have all the stuff in
The
their
other
bus.
thing is I think the community takes some responsibility. Our sidewalks are very poorly maintained in the winter months. And it also helps seniors stay indoors, which is defeating the purpose of preventing falls because you're afraid to go out for good reason.
I'm just going to repeat what you said because I was told to for the sake of television, okay? So yes, women that may have large purses that occupies one arm, that if you were to stumble, that you can't necessarily brace your fall. And also, and that's actually a very good point, weather and seasons, and that's where kind of environmental factors such as like ice outside. Yes, in the wintertime, I would encourage the communities of Huntsville, Bracebridge, and the other communities in the District of Muskoka to really kind of prioritize maintaining the sidewalks so that people can get out and exercise kind of throughout the year so that you don't necessarily, or yeah, that you can safely get out. And let's say you were just getting out to get to your car or get to a ride so that you could come to the like active living center and do some walking on the track. Yeah.
What about, you mentioned something I thought was useful for people in the winter is to walk like a penguin.
Yeah. So something that's useful in the winter is to walk like a penguin. And it's funny that you say that. My mom comments on this. At the hospital in Sudbury, they tell staff, you know what, we're going to ice the parking lot, but what you can do is walk like a penguin. Which, yes, I think like, so what that means, I think, is like a shuffle, basically.
It's not striding, it's kind of
Yeah, kind of like,
side. Yeah.
do you want to demonstrate for me? I don't want to, like, that feels very like this. But I think, but I think what is kind of noticeable about that gait or walking style is that you aren't doing a big swing where you only have one foot in contact with the ground. It's kind of not raising your feet as high off the ground and kind of doing a shuffle so that you're kind of with your knees bent, kind of keeping as much contact and not putting yourself at risk with model strutting.
What about those spiked slip-ons? Does anybody use those spiked slip-ons?
Yeah, they're good.
And have you ever tripped because of them?
Only if you go over your story with
Yeah. So there's the spikes that you can wear on your boots in the wintertime to give yourself that extra grip. Yeah. Go for it.
You mentioned carpet and throws. There's one other thing that I have noticed recently, and that's steps with carpet.
Yes.
Particularly steps with carpet that have waterfalls, that's what the carpet installers call it. So it goes over the edge, but it doesn't go back into the back of the step.
Okay.
And that can easily catch your heel as you're going down. If you've got those should be eliminated. And
Okay.
Just the nap of the carpet. If the nap of the carpet is going down the stairs, which it should, because all carpet has a nap. It's got a direction. And if you've got a cut pile carpet on stairs where water falls over, it is slippery as heck.
Okay.
and it'll catch your heel.
So be really mindful of stairs that have carpet on them, or what is a nap of a carpet?
All carpet, when it's made has the tufts, the yarns have a direction,
Okay.
and they're not straight up and down. They're slightly this way.
Okay, so they may kind of encourage you to.
It looks like it's wet.
Okay.
It's not wet. It's a change in direction.
Okay.
I spent 20 years in the business.
It's like when you vacuum, you can see the vacuum marks because
Yep.
the nap goes back and forth with vacuum, so that's.
So a good installer will install the nap so it water falls over the front of the stair, so that it doesn't open up when you walk on it. It packs it down. But
Okay.
It's really slippery, especially some of the polyesters and nylon.
And so kind of like carpeted stairs, or where the carpet kind of like ends at the top of the stairs, you're saying can be kind of a high risk area, or even on the stairs themselves. Okay. And you can even get, like, let's say you didn't necessarily have carpeted stairs, but there's like the hardwood stairs that you get the tread slips, and you just want to make sure that tread strips, yes. And you want to make sure that that's maintained and not kind of lifted up. Yeah. That's the whole intent of this talk, right? I can give certain recommendations, but also you can be a great resource to one another. Hopefully not trading fall stories, hopefully trading tips.
Oh, I'm not
Go for it.
sure if this is your expertise, but can you describe to us, if we are falling, how to fall to least injure ourselves?
Or
What to
Yeah,
do?
we want a demo.
But I mean, like, I've heard, like, don't put your hands out because you can break your wrists. Like, I've heard, fall to your side. Like, do you, or anywhere we could recommend to find that information?
okay, so the question is there any way that if you are already falling that you could try to kind of limit the damage that you do to fall in a specific way? I don't want to make something up on the spot and then potentially contribute to injury. But what I probably can do is I will get that information, and Paula, is an email going out kind of with the Cogeco link in June? I will get you that information by then, and we will send that with that link, right? We kind of just send a mass email out, so that if there are tips to kind of brace your fall in a way that might reduce the risk of injury. But what I would imagine, like that reaction time to employ those skills, that is challenging in and of itself. So, I don't want to say kind of like, let's do what we can to reduce the risk of falls, but also all of that strength and those exercises for balance that you might learn if you do the exercise programs might help you make a little bit of adjustments to kind of brace yourself a little bit better, so that maybe it's a near fall where you kind of trip and catch yourself because you've got those strengthened muscles, as opposed to necessarily going all the way down.
I know exercise is good for everyone, but if someone has osteoporosis, are there certain activities that should be limited or avoided?
Excellent question. So, exercise. The question was: I know exercise is kind of good for everyone, but if someone has osteoporosis, are there certain activities that should be limited or avoided? And so, for osteoporosis, we know that kind of a degree of resistance exercise, where it's either with bands or low weights or your body weight, to try to kind of encourage your bones to stay strong, is important. I think if you're like, the exercises that I would try to limit would be if you're pushing yourself to the extremes, that might kind of be at the extreme range of motion or the extreme range of kind of weights that you're lifting or pushing yourself. And Osteoporosis Canada has really excellent exercise videos, and you can find them on YouTube as well for certain exercises that are really good for that condition. And what osteoporosis is where you have basically like the bones become less dense with time. And with this condition. And so you get kind of, porous bones or kind of holes in the bones that are less dense, that it can increase your risk of having a broken bone.
Real world case. You're at a dinner party and grandma comes down and misses the bottom step and goes down hard. When do you move her?
When do you move her? Okay, so the real world example: you're at a dinner party and grandma comes down the stairs and unfortunately has a fall and goes down hard. When do you move her? Things that matter in that circumstance would be like your neck and your spinal cord and your bones in your back, where you may not want to move them if you think there is a risk that there's been an injury to the spinal cord. So that sounds like a situation which would really be valuable to call 911.
They're on their way, but
Okay.
in the meantime.
So if kind of you're gonna potentially kind of check in, see how they're doing, and it might just be best in that circumstance to kind of like keep them on the ground and kind of like, let's say, put a pillow under her head gently or something. Oh, I gotta, don't put a pillow under the head kind of look. Maybe don't put a pillow under the head because obviously that involves moving the neck. Ooh, taboo, I was told. Yeah, put a blanket over top of her, whisper sweet nothings to her, tell her she's in good hands, and help is on the way. I love you, Grandma.
Real world story is we have one of the houses built in Huntsville with what do you, no, the lower living room, the sunken living room.
Yes, the sunken living rooms.
The flooring, just this lovely maple, but there's 2 steps down and there's no depth perception. And we had a lady, I mean, we did it ourselves, and then a visitor came and just walked off the steps and you just didn't see the depth perception. And we learned and when we renovated, we put colored strips or darkened the wood on the edges so that you actually can see the edges of the steps, and it makes a whole lot of difference.
I think
that you can fix.
That's a really good idea. So that's kind of the question of like the sunken living room, and when you have like 2 steps down into the living room from the kitchen and you may not be able to see the steps, or you may be at someone else's house and you may not be familiar with their environment. So what can you do as like a homeowner? Sure, if you renovate, that might take you a while and money to kind of get that new wood in there. But like colorful, I'm picturing neon tread strips here. It's like real nice in the living room.
We just stain the edges of the wood.
Oh, okay, that might, yeah. A paintbrush and some stain. Okay. And also, that's where kind of like, people will talk to me about like glasses and bifocals and how they went and got their glasses adjusted and their depth perception is much better, because depth perception literally allows you to kind of gauge whether there is like a change in kind of like how far you are away from something, or if there's like a change in the flooring, and you can hopefully see it and adjust for it before it causes issues. Yeah. At the back, the handsome gentleman. That's my husband.
Which is to reiterate it as well, there are occupational therapists that do home assessments for safety as well. So there may be something that you don't necessarily identify as a risk, but maybe a risk as well. So things like steps, those types of things, they can come in and say, this might be a hazard.
Excellent. So you can potentially request a home occupational therapy assessment. Who I would reach out to first for that would probably be like the Ontario Health at Home. Kind of ask that question of them first. And that might be a professional that is able to come into your home and do kind of an assessment of your home specifically, and how you may be able to add a grab bar here or a raised toilet seat here, or have you considered this to kind of reduce the risk of falls. And for example, in the hospital, we will sometimes, before we send people home, we will ask for an occupational home assessment to kind of get things set up before people return home or the patient goes back home, so that things are already in place by the time they get there, so we can feel better about their safety. Any other questions? Excellent. Well, I really appreciate the opportunity to speak with you and to generally do the presentation, but I'm glad we left time to be able to have great conversation, because you guys are really helpful and you made excellent points, and I really appreciate it. So thanks so much for coming. It's been a pleasure. Thanks to you guys.